Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of February 8th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County and Oakland in particular. Alameda County now has over 76,000 cases, and sadly, we've now surpassed 1,000 COVID deaths for a total of 1,041 COVID-related deaths in Alameda County. Here you can see daily case rates, and thankfully, cases continue coming down. Of course, we're naturally concerned about Super Bowl gatherings and just what appears to be more gathering in general, so we are staying prepared for more cases that may show up towards the end of the month. And in any case, as we've learned with COVID, we must stay prepared for another surge at any time. Right now, just like our case rate, the hospitalization rate is coming down nicely. Hospitalizations in the ICU do remain high. We've still got about 90 people in the ICU with COVID. It is coming down, but slowly. And as we know, ICU hospitalizations and deaths will lag behind cases. Now, what's going on with vaccine distribution and the vaccine rollout? Alameda County now has a very nice dashboard that shows how many vaccines have been administered by city, by race, and by gender. And we know that the rollout in California overall has been more than a bit confusing, as the framework and the guidelines have changed several times over a short period of time. And I think it would be safe to say that there has been confusion or changing information from the federal level to the state and then at the state level as well. And there are kind of different branches that are happening at each level, and within each branch, things are being implemented differently. So that is the reason why some of the rollout looks confusing. For example, from the federal level, there are allocations to retail pharmacies, including CVS and Walgreens, who are contracted to administer the vaccines to residents of long-term care facilities. The federal government also, of course, makes allocations directly to the states. The state of California is allocating directly to the counties, as well as directly to some hospitals, especially those that are in more than one county, like some of the larger hospital systems. And then from the county, they will utilize some of the vaccine for countywide vaccination efforts, and then they will in turn also make allocations to some hospitals and clinics. Doctors' offices may in turn get allocations from hospitals they are affiliated with. So what all of this means is that in one city, at one point in time, you could have all these things happening at once. Long-term care facility residents are getting it from Walgreens, county staff are administering to healthcare workers, hospitals are admitting it to their patients over a particular age, and clinics are administering it to in-home support services workers or patients, staff, etc. All of the people getting vaccinated must be in the appropriate phase and tier. But due to the different methods of distribution I described, and also the different workflows each of these entities will have, it may seem like there's no rhyme or reason to it. But really, each system has its own way of doing things, like some clinics may be reaching out to their own eligible patients, while some entities may be putting the word out more broadly and waiting for you to sign up, and so on. And each entity is also managing internally within their tiers based on their supply. because really at all levels, there really isn't enough supply. So that is why there's so much prioritization happening. So here you can see the different parameters for the different entities in Alameda County, and you can find this on Alameda County's Public Health Department website. And you can see here that this even reflects slightly different criteria, again, within the tiers, depending on which system you are affiliated with. So please take a look at this if you're still not sure how or where you are supposed to be getting your vaccine. As you've probably heard, there are plans for a mega site to be run by Fema at the Oakland Coliseum in East Oakland, and that is anticipated to begin on February 16th. And you can sign up for that sometime soon at My Turn, which is the state's website. So again, refer to the county's website for further instructions for yourself, depending on what system you may be affiliated with. Now, who is eligible at this point? This chart can also be found on the county website. And you can see here phase 1A with the different tiers, and it shows basically healthcare workers, in-home support services workers, community outreach workers, and a variety of other allied health professionals, basically those working on the front lines and out in the community who are not only at risk of getting it themselves, but in turn at risk of giving it to the vulnerable people that they work with. The first of these groups have been eligible since mid-December, and more groups have been added every couple of weeks to include all that you see here in phase 1A. Also eligible now are phase 1B, and this includes our adults age 65 and up, as well as essential workers who are teachers and in child care settings, those in law enforcement, and those in food and agriculture. And note that this is 65 and up, and that is irrespective of any conditions or anything like that, just based on age of 65 and up, you are now eligible. Now, I want to take a moment to make special mention of two groups in our community in particular that may get left out if we don't make some special efforts. And those are in-home support service workers and those providing childcare. And this includes informal childcare. You do not need to be a licensed nurse doing home health or a licensed childcare provider to be eligible. You are eligible by virtue of the work you do with in-home support and with childcare. You are eligible because you are at risk of getting COVID due to the work that you do, but also because you're at risk of spreading it to your patients or the children you care for and in turn their families. So please take note that you are eligible regardless of your age. And if you know anyone in these groups, please do spread the word, since we're finding that many are not aware, especially if they're not connected to a larger health or school system. Now, just a reminder about COVID and the vaccine. If you catch COVID, your risk of getting critically ill is about 1 in 20, and your risk of dying is about 1 in 60. Now, this is, of course, without being vaccinated. So if you do not have the vaccine and you catch COVID, you really are kind of rolling the dice here with a 1 in 20 chance of getting critically ill, meaning hospital, ICU, and a risk of 1 in 60 of dying from COVID. So far, what we're seeing with the vaccine is that the most significant risk is of an allergic reaction, and that is 1 in 100,000. So overall, pretty low risk of allergic reaction, and this is in people typically who have a history of anaphylaxis, and most have been prescribed an EpiPen before. And this is normally more than what we would see with vaccines. So knowing this, of course, all healthcare providers that are administering vaccine are concerned about this. They're on high alert for it. They're ready on standby with the medications needed in case if this happens. But again, that risk is about 1 in 100,000. And so far, it has been treatable in every case where this has happened. And there have been 0 deaths that are directly attributed to the vaccine up until now. And in the United States alone, over 42 million doses have already been administered. So, of course, we will be continuing to monitor and report on this. But thus far, we are looking at a fairly impressive safety profile thus far. Regarding the side effects, these are really expected effects that last 1 to 2 days if you get them at all, and they are more common after that second dose, so please plan accordingly. And what we find the most significant and reassuring is that the vaccine is nearly 100% effective at preventing severe illness from COVID and at preventing death. So while it's protecting you from getting infected about 95% of the time, even if you're part of that 5% who gets it, it will be much less severe and it won't be deadly. And that is pretty major. Okay, so let's say you've gotten the vaccine. Now what? Well, first, I know everyone has heard that you are not fully protected until you receive both doses. And even then, not for a few weeks after that second dose. And how much protection you get after the first dose actually seems to be quite variable. So basically, you cannot rely on any particular level of protection after the first dose. So you will need to continue doing everything the same as before after you get your first dose. You should receive the second dose of your mRNA vaccine after 3 weeks if you got the Pfizer, and after 4 weeks if you got the Moderna. Now, if for whatever reason it is just not feasible for you to get it exactly at that interval, there is a grace period of 4 days prior to your date. And the CDC has recently also added kind of a grace period of up to 2 weeks afterwards, if and only if it is just not feasible at all for you to get it on time. Now, I'm not sure what that situation would be. Maybe if you get incarcerated, maybe. I I can't really even think of another scenario. And even if you do end up, if you end up in the hospital or you end up in jail for that matter, let them know about your vaccine being due. At this point, everyone is actually pretty focused on trying to get this right. But outside of an extreme situation, please just stick to the schedule. Remember, the best information we have on the vaccine thus far is from the clinical trials, which really only looked at this interval. The CDC feels there's enough data to justify that potential 2 week grace period in extreme situations, but beyond that, there really is no data. So there is just no reason to take any chance that you will be shortchanging yourself or having a less effective vaccine by spacing it out differently than what the study showed. And finally, these vaccine products are not interchangeable, no mixing and matching between products. Now, after being vaccinated, if you need other vaccines like the flu vaccine, it is recommended that you wait at least 2 weeks. So, naturally, those who have been fully vaccinated want to know, can I do anything differently now? Well, we've all heard that this is not a ticket to freedom or to going back to how you were pre-COVID. Not yet, not until we reach that herd immunity. But like most other things with COVID, it's really about weighing out your risks and benefits and making the best decision you can with the information available. So let's start with the facts that would weigh into your risk benefit calculation. And again, I am only talking about the situation where you are fully vaccinated. You are considered fully vaccinated about 3 weeks after your second dose. So, some facts to keep in mind post vaccination. First off, the vaccine is about 95% effective. This leaves a 5% chance that you can still get it. The good news about this is that once you're fully vaccinated, it seems that you have almost no chance of getting critically ill or dying from COVID. So, no more Russian roulette with COVID. Also, it's important to note that individual responses do vary. For example, some data indicate that the effectiveness may be a little lower in the older age groups who may not mount as robust of an immune response. Again, all groups showed the basic elimination of risk of death and critical illness, but there still could be a 5 or even 10% risk of getting mild or asymptomatic infection. Second, variants are out there. If you want to learn more about variants, check out the briefing from last week where I went into great detail about variants and what they mean. The bottom line for the vaccine is that they do seem to be protective against the variants, But that's the variants we know about. We know that there are more variants that are likely to emerge. And it also might not be at that same 95% effectiveness. It could start to go lower. We don't know, we can't quantify that just yet, but it is definitely it's a concern. And there's a lot of study going on right now to try to quantify this. And lastly, you could still be a carrier and potentially spread COVID even after getting vaccinated. And of course, the biggest concern here will be spreading it to someone who is unvaccinated, especially someone at risk of doing poorly if they get it. And again, who that is not entirely predictable. So, what if everyone in your circle is vaccinated? If you are fully vaccinated and you choose to gather with others who are fully vaccinated, again, everyone has gotten 2 doses and has waited at least 3 more weeks, then the risk of giving COVID to one another is probably quite low. If you gather outdoors and if you're wearing masks, then it's really probably pretty close to zero. But please do consider your individual situation. Let's say someone at the gathering lives with their grandmother who has not received the vaccine. The concern is that we still don't know the risk of them getting COVID and passing it on to her. Or let's say you have children who cannot be vaccinated yet. Their risk of doing poorly is much lower than grandma's, but still there is a risk. In fact, a very small number of children can get critically ill with COVID, and we unfortunately have been seeing that more lately with this recent spike. And we will be talking more about children and COVID next week. But considering the number of people who remain unvaccinated, the best bet is to continue masking and distancing around unvaccinated individuals, and certainly when you are in public until we reach that herd immunity. Could you gather unmasked if the whole group is vaccinated? Again, your risk of getting it is low in that 5% range. Same with the risk of everyone else you're gathering with who's fully vaccinated. Your risk of having it and then spreading it is also probably quite low. It's true, we do not have all the data on this yet, but if you are feeling fine, you're not coughing, then we think you're not spreading it as much as someone who actually gets sick with COVID. We think your risk of having and spreading it among other vaccinated people is really quite low. The issue remains your ability to spread it to unvaccinated people, and that is a very real concern until we have more data. If there are unvaccinated people in your household, then it is recommended that you hold off on any unmasked gatherings, even if everyone in the group is vaccinated, because you do not want to put others in your household at risk. Now, we know that so many of you out there have been amazing, following all of the guidance, sheltering indoors as much as you can, whenever you can, and only with members of your household. You're masking up, you're spacing out, you're protecting your elders and those with underlying conditions. And we really commend you for that. Has been a long haul and we still need to continue. But let's say, for instance, that you are one of those people who have heeded the guidance and you haven't even gone to the grocery store since March, or you've had something broken at the house that you love to get fixed, but you won't let anyone in. Once you and your household are fully vaccinated, we think you could consider slowly reintroducing these things because your risk of getting critically ill or dying from COVID appears to be eliminated now that you have gotten the vaccine. Your risk of catching COVID again is not eliminated. And if someone at the grocery store or if that handyman have COVID, they could still give it to you, but you're not likely to get critically ill or die. We recommend that you still require that they wear a mask and you continue doing your part with distancing, hand washing, and sanitizing. If you do all of that, then these activities no longer pose nearly the risk that they did before you were vaccinated. If you don't have to do them, don't feel like you need to do them. But if you feel like you'd love to get out or you'd love to get something taken care of at the house and you're going to exercise caution and you remove the risk of dying from catching COVID, then this is part of your risk and benefit analysis. You can weigh what are fairly small risks with the benefit that you feel you would get from doing some of these activities. So, on that note, what about hugging the kids and the grandkids? This has to be one of the most common questions that we hear. Well, it depends on whether they are vaccinated, which of course depends on their age. So, under the emergency use authorizations for Pfizer and Moderna, the following age groups are authorized to receive the vaccine. For Pfizer, it's 16 years and up, and Moderna, it's 18 years and up. Children and adolescents outside of these authorized age groups should not receive COVID vaccination at this time. So I'm sorry to say that you could still pose a risk to them if you go around them after you have had any potential exposure, even if you have been vaccinated. Now, one possibility is for vaccinated parents, grandparents to quarantine themselves for 14 days, essentially removing their risk of being exposed and being a carrier. At that point, they could hug the grandkids. Now, understand that if the grandkids didn't quarantine, then they could still have COVID and give it to grandma and grandpa. But again, we won't be as worried about them as before because if they are vaccinated, they're protected from critical illness and death. Clinical trials are underway now for the younger age groups, and we will be looking out for that data and anticipate that vaccines for children will be ready in a few months or so. So you'll probably want to wait a little bit longer or go through the steps of quarantine that I discussed previously. Now, when are we going to get to this herd immunity so that we can really start to feel a little more like things were before COVID? So this is where we talk about the community considerations or population considerations. And this has to do with the question of when can we get back to some semblance of how things were? When will this virus stop spreading like wildfire and threatening to overwhelm our hospital system? And I'm going to use the analogy of the wildfire. And we're going to imagine our neighborhood here with 10 houses and they're doing fine, but there's a wildfire headed their way. If none of these homes are fireproof and the wildfire comes, they all burn down. Now, if one of the houses gets fireproof and the wildfire comes, then that house will remain standing. So this is you with your vaccine and nobody else has it. Well, the rest of the neighborhood will burn down. Now, if 8 out of the 10 houses were fireproofed, then when the wildfire comes, it would have a very hard time affecting any of the houses in that neighborhood because it just can't skip from one to the next. The 8 that are fireproof protect the 1 or 2 that are not. And that is really what we're looking at with the vaccine. Now, unfortunately, with the new variants that appear to be more contagious and where we're no longer as certain about the 95% efficacy, our math may need to be recalculated here. So it might not be 80%, it might be 85, or it might even be 90. So I think that still remains to be seen. But nonetheless, the principle remains once we get to that threshold of the population that's protected, it will stop that rampant spread of any of the variants. Now, who is in that 20% and relying on the other 80%? Well, right now, that will include some of the groups that I mentioned earlier, where we're still gathering more data, like with children, and maybe those who are in some immunocompromised groups where they are waiting for their physician or their specialist to recommend it. And I would recommend that anyone who's in these special groups to check in with your physician and ensure that they feel comfortable that you are ready to get the vaccine. And this could be based on a condition or it could be based on medications that you're on. So they are relying on others to get vaccinated because they are unable to at this time. But that is how we will get to the point where we have herd immunity. Until then, we've got to stick with the basics. Shelter indoors as much as you can, whenever you can, but only with members of your own household. And remember that household does not mean other family members that you don't live with. It doesn't mean your boyfriend or your girlfriend or someone you're dating. It does not mean neighbors or people in your apartment building. It means household. And this is more true now than ever, given the spread of variants. Don't share your air, mask up, space out. Always protect your elders and those with underlying conditions. If you think you're exposed, don't go to work, don't gather, isolate yourself, get tested in 5 to 8 days. If you have symptoms, get tested right away. Continue to isolate until you get your results. Take a multivitamin supplement and consider additional vitamin D supplementation. Keep track of when you are eligible for the vaccine. And if you know anyone in the eligibility tiers, please make sure that they are aware that they are eligible. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.